Canada, and abroad, of course, in the Netherlands. As you may know, I represent the Kingdom of the Netherlands here in Toronto, and together with my team, as well as my colleague across Canada, I have the great mission to foster collaborations between our two countries, share best practices, and inspire each other. Guided by the Sustainable Development Goals, our economic diplomacy activities are focused on different themes, and health and design are two of our priorities, trying to make Toronto, Canada, the world more resilient and more livable. As you may know, the Netherlands is known for its innovative design, but design is not an aim in itself. It's not about beauty only, it's a way to reach other higher goals. And through their conceptual and researching approach, Dutch designers are able to answer complex issues with sometimes very surprising solutions. And that's why, with the world facing some of the biggest healthcare challenges of our lifetime, I'm proud and happy to introduce you today to somebody who was able to bring the right solution, SeanCarney. Sean is a Chief Experience Design Officer and Business Leader, Healthcare Transformation Services at Philips. Leading the Philips Experience Design Global Organization, Sean is responsible for the overarching creative and design thought, leadership, and strive to advocate and embed design thinking and user-centered design approaches across all Philips businesses. As the business leader for the Healthcare Transformation Services, Sean helps provide patient-focused consulting services to help hospitals and healthcare systems achieve sustainable improvements in clinical excellence, operational efficiency, care delivery, and financial performance. Under Sean's leadership, Philips Experience Design and HTS strive to create and design exceptional patient and clinician experiences, ultimately reimagining and redesigning the future of healthcare in the modern, connected, and aging world. Thank you all for being there. I wish you a very inspiring session. And Sean, the floor is yours. Success.
Thank you. Thank you very much, Sean. Let me just make sure I'm sharing the correct screens. Okay, so I think we're good. And you can also see my webcam now as well. Good. Okay. Well, thank you very much for the very nice introduction. And it was great actually to see that video as we got kicked off there as well. I think many of the topics that were coming out in that video around thinking bold, the responsibility of designers, are really what I'm going to be talking to you about today. So as Anne said, I'm very privileged and honored to lead the design team at Philips. And I'm also very privileged in that I can bring design also into the world of the businesses by leading a consulting team across Philips, which is really geared towards transforming healthcare systems and the way healthcare is delivered in many different countries around the world. And I do that by utilizing design thinking and bringing creativity into a traditional consulting world. So I'm going to take you through a little bit of that story today. As you may know, Philips is more than 128 years old now, I think, a technology company coming out of the Netherlands. You might know us initially for our light bulbs, that's where we started. But over the years, we've pivoted to include things, of course, like consumer electronics and TVs. But in the last 10 years or so, we've also really pivoted to be much more focused around healthcare. So I'm going to tell a little bit of a story now about some of the things we're doing, but more from a designer's perspective, thinking about the role of design, and also asking all of you as a Canadian design population, but really the global design population, to try and inspire you to think about your role in transforming society and the way people can get access to healthcare as well. So let me get started. So I think all of us recognize this year has been a real struggle, and these are unprecedented times with the global pandemic now. We're seeing a virus that's, it started out in one city. I think all of us remember those first news flashes from the beginning of the year with Wuhan, and it seemed, something, not really of interest to us. It was too far away to be of much danger or much consequence. But then look at how quickly that's really spread across the world, and today impacted every single person across this planet. So coupled with that, though, we've also been looking at systemic socioeconomic challenges, and I think these have really further kind of amplified that discrepancy gap in terms of access to quality healthcare, especially for those at-risk and vulnerable communities. Over the border then to the south of you, you've seen some huge discrepancies, as particularly communities of color have really suffered very badly during this COVID crisis. And I think we've seen that mirrored in other parts of the world as well. And not to mention, of course, that we've also, during this last year, seen much more around climate change. And climate change is continuing to impact the way we live our lives and humanity as a whole. It's not something that's just going to be happening in one country, in one area. It's going to impact all of us. And I think what this means is we've really got to start to understand that these major events don't just happen over there. We're all impacted. We're all affected by these challenges. And therefore, it's important that we all recognize we must be part of the solution too. And I think as designers, this is where we can play a leading role. So part of our role, if you think about what you do as a designer, is to really look beyond the realities of today and help envision these more positive futures. Consider how emerging technologies might help deliver better experiences. And in my focus area, healthcare, I believe there are really huge opportunities now for design and technology to help enable much better experiences for both the patients and the staff who are working so hard to treat them at the moment. But beyond that, I think that we as a global design community are in a really unique position. I think we have the skills, we have the crafts, the creativity, and I believe the foresight to really get things moving. And I think this is really important now. We really do need to get things moving more than ever, because I think all of us are beginning to really recognize the need for urgency in changing things. So I think even before COVID-19 really hit us, healthcare systems were really facing a lot of constraints, a lot of resource constraints around the world. Now, as COVID-19 hit, what really became apparent was that we have this huge shortage in medical workers and also, of course, medical equipment. And it's really put a spotlight on this. A recent report in the World Health Organization has shown that there was a shortfall globally of more than 6 million nurses. And this, together with other healthcare shortfalls, has really amplified and exacerbated this COVID-19 crisis. We just weren't ready for this. And as we can see clearly, there's ICU, intensive care units, all around the world who are now feeling the strain of this. So I think right now, of course, we're entering into this second wave. We're anticipating this second wave, but it's actually even worse this time around, because it's not only COVID-19 patients who are going to be queuing at the doors of these already stressed healthcare facilities. There's also other non-related healthcare needs as well. People with other chronic diseases such as cancer and other long-term ailments. And they've been delaying going to the hospital because they were worried. Naturally, they didn't want to go in and put themselves at risk of contracting these diseases, and many healthcare of contracting COVID. And many healthcare providers were also dissuading them from coming in because they just didn't have the capacity to deal with these unfortunate people as well. So this second wave now, you've got a backlog of patients who really now absolutely need therapy, need care, plus the continued increase in spread of the virus. this is putting huge demands on all the healthcare systems, regardless of where you are in the world. And what this is really forcing, I think, people to do in the healthcare world is think about more value-based healthcare. That is a system that really now starts to increase the focus on access to care, whilst also improving the outcomes and lowering the cost of care as well, to make it more accessible to people. Sorry, my slides are stuck. Yeah, okay. Coupled with that, we're also seeing an increase in aging populations globally. And I think with that, hand in hand, is arising chronic illnesses like heart disease and respiratory conditions as well. And this is also putting this extra strain and cost into the healthcare system. And this is why I think we've got, we're also seeing a move from shifting care from the hospital-centered approach into more lower cost settings and ultimately into the home as well. I'm going to talk more about what that means later. And I think we're also seeing a reduction of patients coming into the hospital right now because of these, because of COVID, and that's forcing us to really rethink how we deliver healthcare into the future. It's forcing us into rethink healthcare facility design. Part of my role, part of my team's work is not only designing your next toothbrush or your next MR machine or CT machine, but also designing facilities that those things go into. In fact, we're designing complete hospitals in many parts of the world. But as we're doing this, we're starting to think about, does the world need bigger, shinier hospitals? Or could we actually think about decentralized care models where we distribute care closer to the patients who need it most? And I'll talk later on a little bit about some projects we're trialing in Japan right now, where we're doing exactly that, bringing care to elderly patients in their homes. Sorry, my slides are getting a little sticky here. So, so beyond that, we're also, I think all of you will probably at some point have been wearing some sort of wearable. I think we're all very much more engaged in our health, in our wellness, you know, staring hours and hours on end, staring at your screen, at your Zoom screen or your Teams screen or Skype, is causing all of us to be a little bit more reflective of our own health and well-being. And we've been doing a lot of work around this to look at how we can help engage you. I mean, here we see a nice image of a young girl actually brushing her teeth. And some of the things we've been learning as we've been looking at how do we motivate people to take better care of their health? How do you motivate and inspire a 4-year-old to actually brush their teeth? And we've been gamifying that experience in order to achieve a situation where a 4-year-old actually is going in and sneaking into the bathroom to brush their teeth. And I think all of us as individuals are becoming much more vested in our own personal health. And I think that also then creates great opportunities to focus more on healthy living and also prevention. And I think, again, this is a great opportunity for us as designers to use the skills we've developed around perhaps nudging or motivating behaviors in games or social media channels and things, and put them to good use, make good use of those skills you've been developed to actually help people take a more proactive role in taking care of their health and well-being. And then last but not least, I think we have seen this digitalization of care. And it's really reached a point now where the value is beginning to shift from the traditional standalone products to end-to-end solutions, where we think about systems of smart devices, connected devices, software and services. And that puts us as a design team in what was a very hardware-centric organization. It means we've got to develop new skill sets and new capabilities in order to join the dots and to see how we can create these end-to-end solutions around caring for patients. So one of the things that we're seeing right now is an adoption of telehealth, and that's really beginning to accelerate. And I think this is primarily caused, of course, by COVID. We've also seen a proliferation, I think, in many different countries around the world of COVID triaging apps. And these are really amplifying the ability to share data between different healthcare providers so that they can then track and trace COVID patients. But it's also helping to increase other virtual health activities. So virtual visits to your general practitioner through a video conference. So right from your home, being able to get that consult without putting yourself at risk going outside your home. And I think, you know, some of these trends are really beginning to kick in now. And these are fundamentally going to disrupt the landscape of health technology and the way healthcare is delivered to patients. And we see, you know, governments, healthcare providers, insurers, and consumers all really leaning into this space here. So again, a huge opportunity for design to think about this and to contribute. And I think there are 4 other global trends that now are coming down the line at us and are really helping us to drive a transformation now. So as we think about healthcare from a Philips perspective, I want to start to think about how can we better harness that global power of the design community and expertise to really envision and drive the future of healthcare. So I'd like to explore how we as designers and design leaders can now design with new purpose and urgency and a sense of urgency to ultimately improve the world and make sure that we're increasing access to care for those who need it most. And you know, this is a huge challenge. It's a colossal challenge. So where do you even begin? And I really do appreciate it's not easy. But I'm going to come with a few suggestions here on a few ways forwards. And I think there are 3 kind of fundamental approaches that we can take: an empathic approach, a systemic approach, and last but not least, we need to partner. We need to partner up in order to do this. No one entity should be trying to do this alone. We need to look for ecosystem players and see how we can co-create with all stakeholders across an ecosystem. So let's go a little deeper into this. So designing with purpose from an empathic approach. So as you trained as a designer, you would have probably learned that getting close to the user is the first thing you really need to do. Who's going to be consuming my products? Who's going to be reading this? Who's going to be using this? How will they be using it? And the most effective solutions, I think, are when you really go beyond that. You really start to empathize with your end user. But it's sometimes, you know, I'm a designer, I'm an industrial designer, not a graphic designer, but it's sometimes we can forget in the heat of the moment, you get caught up in that kind of maelstrom of creativity, and inevitably you fall in love with your idea. And I think we've really got to make sure that we're shaking ourselves out and making sure that we're looking from the eyes of the people who'll be using this product. And so one of the things we've been doing at our Philips Experience Design team is making sure that we really live and breathe around the notion we've called radical empathy. So going deeper than just empathizing, really taking a radical approach to how we do this. So we send our designers into the surgical room, into the operating room. There are 3 designers in this room full of cardiovascular surgeons on the image right now. And they're helping redesign a minimally invasive surgical procedure. So they're working with clinicians, they're working with radiologists, they're working with technicians and nurses in order to improve the clinical workflow and at the same time make sure that we can enable those clinicians to deliver a better outcome to the patients as well. And I really think that by having designers witness this firsthand and see, rather than just look at the challenges, they can better understand the context, the ways of workings, and I think through that we're better able to identify and focus on solving the right problems and creating more meaningful solutions. So that's why we send our designers into the field, so they can really develop this sort of radical empathy, this empathic approach for people in the context of use going forwards. And this is where my call to action to you would be. So be empathic and really practice radical empathy. And I think now more than ever, it's vital that as designers, we understand and relate to the reality that people face when they're using our products or services. Context is changing all around us. Our whole world just turned upside down in the last 9 months. So it's vital that you really immerse yourself in the reality of where your products and services will now be used. It's likely to have changed. So understand also the emotional state, the triggers of every person in a given situation, and how their needs are evolving, how their behaviors and their deepest wishes and hopes and fears are also moving. So take a walk in their shoes, shadow and observe them as they go about their tasks, and get involved. And I mean, really get your hands dirty. Or in my case, or in the case of my team, the big joke is this is why we all wear designers. Designers wear black shirts. It's not to be part of the priesthood of design, as I think Tim Brown once said. It's really because we're so close to the action, we're going to get blood on them. So you might as well be wearing a dark color. An example that I'd like to share with you is how we've used this radical empathic approach in a really underserved community. And that is as we were developing what we called our community life centers in underserved communities in Africa. So Tedros Adhanom, the Director General of the World Health Organization, said that primary healthcare is where the battle for human health is won and lost. And this is a substantial challenge, a real challenge in Africa particularly. And so this is why we set up these community life centers to service these underserved communities across Africa. And they offer a real community-driven, holistic approach to improving primary care. And again, we sent our designers for a few months at a time into Africa, immersing themselves in these communities, spending times with families, with the community health workers, with government officials, and other stakeholders like NGOs, all of who are really playing a critical role in providing primary health care across Africa. And our team, our design team, facilitated multiple co-create, that's our name for design thinking, multiple co-create workshops in partnership with the International Red Cross, so that all the key players in that ecosystem could also really develop a deeper understanding and appreciation of all their respective needs. And equally what this was doing was helping them build empathy for one another. Very easy to think about the NGO or the government official or the community healthcare worker having opposing needs or opposing desires or opposing wants. But by doing these design thinking sessions, by bringing people together, what we really found was an enhanced sense of community and helping people come together there. And I think, again, this is one of those secret untapped powers of design thinking, is to bring people together in this way around a common goal, common objective. So our designers wanted to design the community life centers that worked for everyone. But importantly here was develop a sustainable solution for these underserved communities. So it's important to us that this wasn't seen as a purely philanthropic activity. I mean, it's fine to go put money into these systems, but we wanted to know that as we then walk away or we leave these communities behind, they can actually sustain this system, keep these things going, and all their patients will continue to receive the same quality of care. So going a little deeper into this, one area of focus in these community life centers was high-risk pregnancies and at-risk pregnancies. And most of maternal deaths around the world really do occur in these low and middle-income countries. One of the causes is basically just a lack of understanding of the warning signs of an at-risk pregnancy. So the team spent time again with many expectant mothers across different parts of Africa, with their healthcare workers and their community leaders to make sure that we understood their needs, their culture, the context with which they were going through this pregnancy, and understanding where they lived, their reality. And the team then, we created a set of pocket-sized cards, very basic, very simple, waterproof and tearproof. And each card was really designed to raise awareness about a particular symptom and about the importance of a timely referral to a doctor. as well as how the mother can keep herself healthy during the pregnancy. And what we found actually was they were also doubling up as a teaching aid for the local, often semi-skilled healthcare workers as well. I remember the literacy level in some of these very remote regions is actually quite low. So these had to be very intuitive and easy to understand. So, you know, we're not going to win any graphic design awards for this, I appreciate, but they do the job and they do it very effectively. So they're super simple and they're part of a high-risk pregnancy toolkit that we've then put into play with the International Red Cross. And now these are being deployed across the world and helping save lives in many other parts of the world as well. And the kit also contains things like this. This is a double-headed fetoscope, and it allows you, for the health worker and the expectant mother to both hear the baby's heartbeat. Now, there's no technology here. It's literally like a funnel and a tube. It's a very low-tech solution. And the importance of that is it can be produced locally in that community. And it's a beautiful example, I think, of how when you're designing for true human connections, you can really make an impact and make a difference. And the Red Cross is now using this to help, well, their figures are 120,000 women year to date, and they're hoping to extend it to hundreds of thousands more by the end of 2020. And this sort of simple innovation did, however, it triggered some interesting technology products too. Whilst the cards and the fetoscope would help identify at-risk pregnancies, it remained difficult for many of the expectant women to then go on and access more detailed care and get the necessary follow-ups. So this triggered us to then look at how we could bring ultrasound into these very remote rural settings. And what you're seeing on screen right now is an ultrasound transponder that can then plug into any mobile device or tablet. And there's a simple app running on that device there where we can use AI to basically enhance that and help semi-trained radiologists, semi-skilled workers in the field to identify problems and identify at-risk pregnancies. And beyond that, then the user also has access through to the best radiologists' knowledge and insights from anywhere in the world through the cloud to support real-time clinical decision support. So what I like about this is this was a system that was initially conceived to support remote care in Africa, and it's now being used in a number of other countries, including Canada and the US, with highly developed healthcare systems. And what it's doing is allowing us to now put ultrasound into the hands of midwives, physiotherapists, on the sports field, or perhaps primary care workers in ambulances or emergency departments who are treating COVID patients right now, and who otherwise would have had to wait for those patients to go to a radiology department and get in front of a fully blown up radiology team. So I think, you know, we're now in a world where it's still the loudest who get the most. So I think it's up to us as designers to really advocate for those without a voice. I think we really must begin to design for everyone and not just the privileged few. And as I just showed you, when we do this, it can also then bring benefits to many others too. So this is a concept or a framework that we've called value amplification. And I'm going to put a link at the end of my session for you to download a booklet where we can, which we recently published around designing with purpose. And that will show you in a lot more detail than I can go into here, some of the projects and some of the ways in which you also can contribute. And I think what this also highlights is that we need to design with a systemic approach. So simply looking at healthcare systems around the world and looking at how they're responding, often heroically in this global pandemic, really highlights the shortage of not only medical workers, but medical equipment. And it's becoming ever more apparent day by day at the moment. I mentioned the shortage of 6 million nurses, but you could say the same if you look at pathologists and radiologists and specialty clinical professions as well. there's many shortages around all of these health systems, and right now we're seeing this huge shortage of ICUs as well. And I think this makes it really evident that we need a systemic design approach to not only improve point solutions, but to really look at how we improve the whole healthcare system and the way healthcare is delivered. And I think that means, as a design organization within Philips and as a design community globally, I think all of us need to move on from focusing on point solutions to focus on thinking about end-to-end solutions, to think about systems. And it's by creating these shared solutions that will create together, that will create new value systems as well. An example of this, I think, is related back to COVID, where our team was rallying to the cause in the Netherlands, and in the course of just 1 week, during the peak of the pandemic back in March and April this year, we really had to put together this COVID-19 screening and triage app. So back then, our primary focus was how do we reduce the strain on the healthcare facilities to deliver the right care for patients in this pandemic. So we were looking at screening and follow-up solutions, and all of these were aimed at reducing the strain by remotely screening and tracking the patients with very mild symptoms. Now, we had to do this by reaching out and partnering with all of the Dutch general practitioners, the local hospitals, the regional hospitals, and then we also pulled in early on in the development potential patients and had them look at pulling all of this together into one simple to use application. And what this did was really help reduce the number of unnecessary in-person consultations, so people showing up at healthcare facilities looking to be tested. And it allowed then the healthcare facilities to focus on patients for whom care was really necessary. And what we then also did on the back of all the data we were pulling together was very quickly assemble a dashboard to give the healthcare professionals the means to gain an overview of the current situation across all of the Dutch hospitals, so they could understand at a glance which hospitals were running at capacity and where a hospital had a free ICU bed, so we could then make sure the patients were going to where they could get the best care in the most timely manner as well. And again, this crisis also triggered us to think about how can we coordinate care across health systems. And I think care will, and increasingly already is, move beyond the hospital. I think we're already beginning to see that we will be able to access diagnostics in the high street very soon. We're going to see therapy in very non-traditional settings. Do you know there are parts of the world now where you can go have a stent placed in your heart in a shopping mall? This is called office-based labs, and there'll be more of that to come. You'll also see more specialist clinics and general practitioners with things like access to ultrasound and more precision diagnostic tools as well. And even in your home, I think we're going to see more of a system or network of smart devices, and along with personal wearables, that all begin feeding into your own personal health record, where there'll be artificial intelligence scanning and looking for anomalies in the data, and it'll be able to spot and indicate where there's a deterioration in your health and help prevent further deterioration and direct you to your healthcare provider. So as I mentioned earlier, in Japan recently, we were requested to help design a new hospital. Now, Japan faces this huge challenge of a rapidly aging society. And we questioned, is the new hospital really going to be the most empathic approach to servicing this super aging population? If we were to take a more user-centric approach, a more empathic approach to meet the needs of that population, then shouldn't we try and find a way to bring care to them? So designing with the elderly in mind, we basically wanted to go beyond the usual approach to elderly design, which is, increase the font size, make sure there's good signage, make sure you've got wheelchair ramps. So what we did was think about how can we bring care out into their home and into their community. So together with Toyota and SoftBank, we've created this mobile care delivery vehicle that can travel out to people's homes to provide this primary care and therapy where people live. Now we've done this as basically a proof of concept. We've got 3 of these vehicles running around Aina city, just outside Tokyo. And we're learning from this, connecting the data, and then making sure we can scale this across the whole of Japan very shortly. So finally, as we come to this third approach, as the challenges we're facing are becoming really complex now, and more they're interconnected. So I think it's our role as designers to also change. I don't think any one single designer is really going to be able to address this challenge. It's going to be too complex for you to understand, for all of us to understand. And ultimately, I don't think we can do it alone. I think we've got to partner with all stakeholders across an entire ecosystem, whatever industry you're working in, and particularly in my space, across healthcare, so that we can really design these experiences and make sure that they're sustainable and effective for the long term as well. My final example today is just over the border to the south of you. So where we worked with the US Department of Veterans Affairs. And this is the healthcare provider for the veterans. And it's about 9 million veterans who are accessing care every year in the States. And about 1/3 of those veterans are living in rural areas. And these guys have huge distances to travel to receive their care, often living 3-4 hours away from the nearest provider. So what our designers did, we went to them, we worked closely with the veterans in a number of very remote locations to understand their key challenges and the reasons they were seeking the treatment, what types of care they were looking for or needing, and what sort of interventions they needed. And we created a solution that we're now piloting in 10 rural access points in the halls of the American Legion and the VA to conduct these telehealth sessions with their healthcare providers. And we're learning, we're capturing that, and then once we've done that, this will be expanded to cover hundreds of sites across the US. And this is all part of the journey we've been on within our design team at Philips and our consulting team at Philips to meet our commitment, and this is a commitment that we report in our annual report in Philips around providing access to care for 400 million people by listening to the needs of people on the ground. And there's 400 million people are in underserved communities. And what we're trying to do is make sure that we connect directly with the people living and working in these underserved communities, alongside the support of global and local teams and partners. And that can be the governments, the international NGOs, the academic institutions, or private sector companies and banks. And I think it's crucial that we as designers really begin to leverage our craft to find opportunities to partner up and design for these human connections. And whether that be with the International Red Cross or ministries of health, pharmaceutical companies, or even competitors, I think we need to leverage the collective strength of many to drive these sustainable solutions to these global challenges. And I think as we live through this global pandemic, it's on all of us to use our design expertise and our craft with newfound purpose and urgency. And I hope we're all able to really get our hands dirty and design for everyone, not just for the privileged few. And I hope we can collectively shift our focus from solely on products to more system thinking, and where the value is no longer about just the thing we sell, but more about in the shared solution that we're creating together and the new value systems that we then enable. And lastly, I think you can clearly see the importance of not feeling like you need to drive this change and have impact alone. I think we really need to make sure that we're doing this together. So another thing that I can leave you with is we're one of a number of leading companies, I think, who's beginning to think like this, very much aligned with the UN Social Development Goals, Sustainable Development Goals, sorry. And over the last few years, we've been putting together this Designing with Purpose booklet. And It's a comprehensive kind of collection of insights and documented and proven design practices from around the world, which we believe will help address systemic challenges around health and well-being for all. So take a look at the QR code, take a snapshot of this. You can also follow me on LinkedIn and Twitter, and we'll also post it there again very shortly. And I hope it inspires you, and I hope it'll encourage you to participate in this transformative journey that we're all on to transform healthcare. Now, the organizers asked me as I round out now for you to just take a moment as I finish and reflect on what I shared today. And what I would like you to do is think about how can we better harness the global power of our design community and use our expertise to really bring sustainable impact in improving the world. So thank you for your attention, and I think you can put your comments in the chat. And I think there's going to be a moderator coming back on now, maybe Nicole. So thank you, and thanks for your attention.
That's me. I'm the moderator. Okay. Thank you, Sean. So we have about 10 minutes time for some questions from our audience. So just a reminder to the audience that you can ask questions in the questions tab here in the webinar control panel, or I'm watching the channel #KeynoteTalks on Discord. So our audience will take a minute to drop their questions in. But I'm interested. There's this conversation that's popped up in the Discord while you were talking about the idea of empathy and its potential use as a buzzword at this point, and how do we make sure that we are in fact practicing radical empathy and not just throwing the word around and dehumanizing it?
Absolutely. I mean, this is why I put that little modifier in front, radical, because I felt it was being abused and people were paying lip service to it. And I challenged our team to really go the extra mile. And then as we're reviewing our creative output, as we're reviewing our concepts, we don't let them get away with just sort of the usual, well, we did a bit of market research, we did some user trials and so on. I really do want to see that they were in there, up to their necks in this experience, fully immersing themselves in the reality of, you know, the users that we're working with.
Yeah. And I guess I'm curious too what some of the strategies you and your team use to sort of remove their own experience from the lived experience of the users they're trying to gain perspective on, right? I think a lot of the examples that the work that you do has a tendency to exist outside of North America and Europe. And so that sort of Eurocentric privilege that we have of living in these first world countries. What are some ways, some strategies that you use to make sure that doesn't come into play as well?
Well, I think the other part of it, and I didn't go into that today, is inclusiveness. And inclusiveness is both for us as a design team to make sure that our design organization globally reflects the people we're designing for. And so, you know, it's been around, historically it's been around gender, then it's become about race. But I think it's also making sure that we're getting people in who come from these underprivileged communities as well, and giving them the opportunity to come and be designers and to practice design alongside us. So I'm fortunate in that we've got 12 locations at the moment, design studios around the world. So I think there are 4 across the US right now, but we've also got teams on the ground in Brazil, in Israel, Middle East, in India, and different parts of China, which makes it a lot easier to get closer to the reality of how people are living their lives. Yeah, and I also encourage our design community, and we've seen this recently with the Black Lives Matter movement and the whole issue around access to care in North America, with the disproportionate amount of people of color suffering from COVID or dying from COVID versus people in other parts of the community. And we don't have an answer yet, but what we've done is rally the troops across our team to come together to go deeper into those communities and try and look at what are the underlying causes and see how we can help modify that and change some of the outcomes here.
Yeah. On the topic of COVID, I have an audience question here. Who's looking for suggestions for strategies in getting that kind of firsthand radical empathy research done, experience gathering, when COVID actually prevents us from being in the room with those communities, those subjects?
Yeah, it's been the first few months, it was a sudden shock to all of us. And, that was one of the things that we really struggled with at first was, well, how am I going to now connect with my end users? How do I engage users to participate in the design process? We use a number of online tools. So we're using Miro, to name one. Good plug for Miro here. What we found is that's actually a really intuitive, easy to use tool where you can co-create. You don't need any particular great skill set or training to use it. But what we can do is we can pull in nurses and patients and people who are not typically using software applications. And within a few minutes, they're comfortable having a dialogue, moving things around on this board and co-creating. And so that's one of the tools. But we also, we would have done maybe focus groups and visits. What we can do now is set up a camera in, let's say, a nurse's cafe or rest area, and then engage a dialogue with them in there. And because people are now talking on Zoom, talking on Teams and Skype has become the new norm for us, we're finding that they very quickly get comfortable, sit down and have very open dialogues and discussions with us. But of course, we're making sure that where it's safe to do so, we do still go into the hospitals. Now, one of the benefits I should also mention that I have is part of my consulting team are also running emergency rooms around the world. So they're actually day to day, there are many trained nurses and chief nursing officers. I also have a counterpart in the Philips team who's our chief medical officer, and we have about 150 doctors on staff. So we're also able to tap into their knowledge, their insights. And as we're running an emergency room that's under enormous COVID pressure in one of the states in the US, we do a check-in each week so we can understand what are the challenges and the needs that are emerging for them. So we're getting real-time feedback from the field there.
That's so interesting. So you actually have some of your community members on the payroll as part of your team. That would help.
Yeah. I mean, that's, again, it's when we talk about diversity and inclusion, it means that I think design shouldn't be only about designers. I absolutely celebrate the craft of design and the education of designers, and I think designers can do wonderful things. But I think designing, we need participation from many other disciplines as well. And some of the really nice moments for me have been seeing people who have a clinical background, trained as doctors or radiologists or nurses. Now we've educated them in a design thinking approach, and they're able to go and facilitate design thinking sessions themselves, which is fantastic to see. I still advocate always that you need a designer, a design doer in the room, as well as a design thinker. But having people from different backgrounds, I think, is hugely powerful as well.
Yeah, that's really interesting. There's one more question here, and it's probably all we'll have time for. But as designers, we're often responsible for creating stuff, so putting things out in the world. The R&D required to create planet-friendly materials or methods can be prohibitive to smaller budgets. And I think that's probably true of a lot of the larger research gathering projects you've shown us today. How can larger orgs like Philips play a role in democratizing sustainable products? Is there a role you can play?
Yeah, I mean, well, first of all, download that booklet I sent you, because there's a lot in there about circularity and about designing circular systems. So when you design, there's how you think about recovering and reclaiming, design for disassembly. Some of the biggest challenges we face in terms of using recycled materials is gathering enough of that material back in order to use it. But more and more, I mean, all of our capital goods equipment, the big stuff, the MRIs, the CTs, X-ray machines, and etc. that go into hospitals are now 100% circular. So everything we sell, we take back at the end of life, and then we scavenge and salvage components and materials from it, or refurbish it and then move it back out again, back into use. But I think there's a role for big companies and small companies, and absolutely it's up to us as a big company where we've maybe got the privilege of having access to knowledge and research and bigger budgets, to share that with the global community, which is what I'm trying to do today by publishing also this booklet that we've recently created.
Amazing. Well, I look forward to downloading the booklet and taking a look at it. Thank you, Sean. Thank you for sharing all of those case studies with us, for spending time with us today. To all of our audience listening, our next session begins in about 30 minutes time. If you've not done so yet, please register for the session that you'd like to attend. You have 3 options. These will be concurrent sessions. You'll receive login information in your email. Details will appear in Discord and your confirmation email. There you go. Thank you again, Sean. It was such a pleasure chatting with you, and I really appreciate you taking the time.
Nice to meet you. Bye-bye.
Bye.